Lodwar, the headquarters of Turkana County. This expansive county covers 77,000 square kilometers. The county, with a population of about 1 million people, borders South Sudan to the north, Uganda to the west, and Ethiopia to the northeast. Traversing this region is not for the faint-hearted. The terrain is brutal. Only a few hardy vehicles are capable of tackling the rugged landscape here. During dry season, the weather is scorching. Kibish sub-county is within the Lemi Triangle. In this far-flung corner of the country, essential services are hard to come by.
We want to work with a special kind of person called Emuron within the Turkana community.
Ikong Peter Epetet is the Emuron here, a traditional leader. He is powerful. His word is considered law. No one contests his decrees.
He is the overall decision maker. He is the overseer. He is like what one would also refer to as a paramount chief.
The Emuron's cabinet is composed of a council of elders. Under the shade of the Tree of Men, cabinet sessions are held. Serious issues touching on pasture, security, animal welfare, water, and many more are discussed.
In terms of calamities, whether it is epidemics, whether it is rain overflow, and whether it is other diseases, he is also supposed, by his nature and the networks, he is supposed to know and predict.
The white marks mark the prediction the Emuron has made, and the county government doesn't take this for granted.
As a county government, we are putting in place interventions that are geared towards distribution of nets and also indoor residual spraying, IRS, so that we can be able to cap issues of malaria. And Kibish is one of the areas which have been targeted, so that at least we can be able to distribute these nets, especially to the most vulnerable communities, pregnant women and children under 5 years.
In such a crowd, the Emuron has 2 or 3 members of his cabinet. He is constantly abreast of the happenings in these dwellings.
This is a site of a lady who died out of pregnancy complication. So the old man has actually brought us here to witness
all the things that kill women in pregnancy. We know what they are. We know how to treat them. We know what can be done about them. We have the resources to do something about them.
Looking at the maternal mortality ratio in Turkana, we have 1,594 women dying with pregnancy-related conditions out of 100,000 live births.
The nearest health facility to this kraal is Kokuro, 15 kilometers away. On average, almost 30 kilometers separate one health facility from another. All are ill-equipped and understaffed. When labor pains strike a woman, reaching skilled personnel can only be a dream. It's seldom a reality. There are no ambulances. The Emuron's wish is one.
yeye anataka pikipiki yenye na operate kama ambulance. Yenye itafanya yeye akimbie in these villages, unajua they are distance apart. Akiangalia wakisema ati mtoto hapa ni mgonjwa, anasema wekeni kwa pikipiki peleke hospitali. Yake ya patrol.
Richard Wanjala is a technician at a religious organization within the county. He's been crisscrossing the region, lending a hand in digging water ponds for livestock and human consumption.
Maisha ya hapa area yenyewe ni ngumu. Barabara hatuna. Usalama iko chini sana. Kwa sababu kuna watu wale kuna majirani wetu wale wanaitwa Marile. Na tunapakana nao. Unaona most of the time wanakuja wanasumbana, wanaiba mifuko kama hizi mbuzi. Mtu akishaumia akishapigwa risasi, mostly ni mission inashughulikia. Iende ichukue hiyo mtu, imtoe hiyo mtu, impeleke wapi Lodwar au impeleke Lokitana.
Sometimes it's difficult to predict where nomadic pastoralists are so as to take vital services to them. It's hoped that the Emuron's influence will be tapped into.
If we convince him that it is nice to work with us for the good of his people, then he will encourage and decree his people to take the services for which we are operating under, or the services which we are providing.
Mkubwa yetu akisema kitu sisi tunaenda.
Afya Timiza project is an USAID funded program that focuses on improving maternal, child, adolescent health, with a focus on mainly looking at issues of reducing maternal and newborn and child deaths.
The Emron will task his cabinet with the responsibility of relaying his decrees to the crowds. If not, then wherever his people are.
Afya Timiza project works in an FPRMNCH context, family planning, reproductive health, maternal, newborn, and adolescent, child and adolescent health concept. But of course, including issues like nutrition and wash, which are also water, sanitation and hygiene, which are also critical in service delivery.
We decided to use the concept of the Kimormor. Kimormor is a Turkana word, which is in principle very similar to the Huduma centers you see all over the country. The difference in Kimormor is we bring the services to the people.
Afya Timiza thought that it's good if we can work with the hard to reach areas, and especially reaching the nomadics where they are.
Those who've never laid their hand on an identification card line up. Other services are birth registration, immunization, food distribution, and animal vaccination.
Nimepata maneno ya kukata kupande na kupeana madawa na chakula ya watoto ile ndogo ndogo hii na uji wa mama.
Water scarcity bites. During dry spells, scoop holes on the bed of such a river serve as the only source of water. The very low toilet coverage in the region renders these water supplies unhygienic. No household treats the water. There have been attempts to drill boreholes like this one. For 3 years, it's not been useful. It's condemned. The level of salinity is just too high. Desalinating it hasn't been attainable. The Emron is unsettled.
So, sema alifungulia hii maji for like 2 days. Hapo kwa hiyo tank ndio wanyama wakunywa. Ile walikunywa 5 wakakufa.
Meanwhile, there is no source of safe water for the residents here. They keep scooping it out from this riverbed. Malnutrition is widespread.
Turkana has one of the highest malnutrition cases in the country, with a malnutrition percentage in children over 37%. That is the highest anywhere in the world.
The malnutrition is occasioned by drought and the absence of water. The few fresh water sources are only sufficient for scanty irrigation. In Kaikor, a self-help group has been growing vegetables to supplement their diet. As the inhabitants of Kibish, Loima and Turkana South wait, their hope is that the Kimormor will keep coming to them.
Ni palona